Hi everyone, welcome back to our Ask All About IVF session again. So thank you Dr. Hatta and Dr. Chong for giving us the time to join this. So hopefully today will be a good session in answering all the questions we have. So let us start immediately. So first, hi doctor, currently I'm under treatment at Hospital Likas for endometriosis and taking white cell. Is there any chances for me to get pregnant if I stop taking the medication and I am 38 years old now?
Okay, I'll answer that question. So endometriosis and currently on Visan, which is a common medicine we use to treat endometriosis. So any chances to get pregnant after we stop taking the Visan? The answer is yes, definitely yes. But we also have to consider a few other issues. For example, make sure there's no other fertility problems. For example, if both your tubes are healthy and the husband's sperms are normal, then yes, it is fair to try naturally for maybe 3 to 6 months. And secondly, we also need to know the stage of your disease, because for mild endometriosis, when the disease is not so severe, the chances of getting naturally is still quite good, but not for those with more severe disease. And factor number 3 that we have to consider is the female age. For somebody who is 38 years old, we also don't advise to delay too long. So the advice will be, yes, please try naturally, but probably give yourself a time frame of 3 to 6 months. If you get pregnant, wonderful. But if no pregnancy, then we advise you to move on to IVF. As we always want to remind our patients, don't delay treatment. We should do it while our chances is good. So I think the advice you'll find helpful.
Thank you, Dr. Chong, for the good advice. So let's move on to our next question. Our next question is, what is IUI?
What is
Dr.
IUI?
Hatta explain that for us.
Okay, what is IUI? Let me show you. IUI basically means intrauterine insemination. That means we put, in layman's term, we put back the processed semen or sperm from the husband back into the uterus of the wife when the wife is fertile. So it is a process whereby, if you look at here, for this picture, for instance, it is where we get the husband's sperm and we process it in order to get the best swimmers, the one that moves forward, and sometimes it also can increase the number of the sperm through this process. This process involves done in the lab. It is done in the lab, and it usually takes about 45 minutes or so. So once it is ready, at the end of the process, what happens is that we have good number of sperms as well as good swimming sperms. And after that, we'll put it back into the uterus of the wife so that the sperm do not have a long journey to meet the egg at the end of the tube. So it bypasses the cervix, it bypasses the uterus, it goes straight into the tube and then meet the egg at the end of the tube, and hopefully there will be fertilization. If you look at the figures like that. So it is done in the clinic. It's a very easy process. It doesn't take too long. There is no pain, because people ask us, is it painful? No, it does. It's not. It doesn't cause any pain. It's just like doing a pap smear. And when do you do it? You do it when you have a normal sperm or slightly low sperm quality. When you have ovulating wife, the wife ovulates every month, but you must also have this, the more importantly, is you must also have both tubes, or at least one of the tubes, not blocked or patent. So that is where that is the best candidate, I would say, for IUI. Usually, to increase the chance of pregnancy, we will also give the wife tablets or injections of hormones to increase the chance or to increase the success of the IUI. Okay, it's we either give tablets, clomiphene, for instance, or Femara, or injections of FSH in order to increase the chance. So what it does is it stimulates the ovary to produce more eggs. But in IUI, we do not aim to have a lot of number of eggs. Usually, one or two is sufficient enough. Then what we do is we do an ultrasound scan to monitor the follicle growth. And once you are fertile, once you're at the point where you are fertile, that is where we do the IUI. So IUI is a simple process. It can increases your chance of pregnancy, but you have a certain criteria of patients which are fit for IUI. So to get more information, I would suggest you to come and pay us a visit, and we can explain more on IUI and whether IUI is suitable for you or not.
Thank you, Dr. Hatta, for the explanation. So if you guys need to know more about IUI, we do have an IUI video in our YouTube channel, Sabah Care Fertility Center. So please feel free to drop by and look at our video so you can have more background information and knowledge on that. So let's move on to our next question is, what is IVF and which one is better comparing to IUI? So can Dr. Chong please explain that to us?
I'm sorry, I can't hear you at all. Dr. Hatta, can you repeat what she said? I can hear you better.
The question, I think, is what is IVF and which one is better? I've explained about IUI and they want to know what is IVF and which one is better.
I hope I can help Michelle later. So for now, please be the messenger in between. Okay, sure. IVF can be considered the most advanced type of fertility treatment. And basically, it means we take out the woman's eggs, fertilize with sperms outside the body, which is in the lab. And once we get the embryos, we will transfer it back to the woman's uterus. So you can see the difference between IUI is that IUI is still more natural because the sperm still end up fertilizing the eggs within the tube inside the body, but everything happens outside in the case of IVF. And who needs IVF? First example will be patients with blocked tubes because we need the tube for the sperms to meet the eggs. So if the tubes are blocked, then we have to make the egg to meet the sperm outside the body. So that is the first indication. And number two will be those with unhealthy sperms. For example, if the sperm count is too low, or if they are not active, and we are afraid the sperms can't swim all the way up to the tube to look for the eggs, then they need help. So in IVF, we can help the sperm to meet the eggs outside the body. So which means patients with poor sperms, they also need IVF. That is why we also always insist to check the husband's sperm at the very first instance so that we can make decision from the beginning. And how do we do IVF? First of all, the woman needs to undergo hormone injections to make them produce eggs, and that usually takes about 10 days duration. And during this 10 days, we will scan them to monitor the egg growth. When they are ready, we will perform a very simple procedure called the egg collection. And it is always done in the operating room, but with only very mild sedation, which means they can go home maybe 1 to 2 hours after the procedure. So usually we will fertilize the sperm and the eggs the same day, and we let them culture and grow and develop into embryos in the lab. So usually in 2 to 5 days time, when we have a healthy embryo, we will transfer it back to the woman's uterus. And we wait for 2 weeks. And during these 2 weeks, the woman will need to go on some medication to support the uterus to help in the embryo implantation. And upon 2 weeks, we will do a pregnancy test and we will know the result. The advice I always give to my patient is even though IVF has the highest success rate among all fertility treatments, usually we take an average about 30 to 40%, but female age is still the most important factor that determines the success of IVF. In other words, the older the lady, the lower the pregnancy rate. The younger, the better. So we always advise our ladies not to delay their treatment. So you should do it while you are young and when your chances is good. So which one is better? Of course, IVF has a higher success rate than IUI, but it is more costly and it's more complicated. So I would still say suitable ladies, when they are suitable for IUI, you can still try the simple treatment first. And usually we let them try it about 3 to 5 times. If they're lucky, they get pregnant. But if they still fail after a few attempts, and that is when we will encourage them to move on to IVF.
Thank you, Dr. Chong, for the explanation. So if you need more information or more background information on IVF, we do have an explanation video on IVF in our YouTube channel, which is Sabah Cat Fertility Center. So please feel free, everyone, to visit our YouTube channel for more information on these few big topics. So let's move on to the next question here. Is about tax exemption from LHDN.
I think I'll answer that. We have a lot of questions also from patients for what tax exemption. As you know, last year's budget is announced that starting 2020, couples seeking fertility treatment, be it IVF or IUI or any other fertility treatment approved by the medical practitioner, are entitled to claim under income tax relief in Malaysia up to 6,000 ringgit. Up to 6,000 ringgit. So we have been also asked 6,000 ringgit. That means the 6,000 ringgit per person is actually, you can go to the website of LHDN and they have question and answers. They have data there on how you can ask for tax relief. But basically, the deduction for the fertility treatment, as I can see here, if the husband and wife files tax separately and the receipt of treatment was issued to both husband and wife, should equally say 12,000 ringgit. So 6,000, is it allowable? Yes. So basically, each can claim for tax relief up to 6,000 per person. So that means up to 12,000 per couple. And if they also ask if I already have children, 3 children, I'm going for the 4th one, have difficulty to go for pregnancy. Am I entitled for tax relief? Yes, according to LHDN, you still can apply for tax relief up to 6,000, even though you go for the 3rd or 4th or 5th child. So this is one of the good news that we received last year for our fertility couple, so that they can try, keep on trying to conceive with the help of IVF or IUI, and hopefully this can lessen the financial burden of our patient. And as you know, we already talked about this before, EPF, KWSP. Also now you can take out money from account 2 for fertility treatment. So this is another added bonus. So to our couple who have been trying to conceive and been trying to get pregnant with help of ART or IVF or IUI, now these are the other things that you can add on to relieve their financial burden, so that you can hopefully have a good family.
Thank you, Dr. Hatta, for the explanation. I hope that cleared up all your doubts.
Suddenly I can't hear you, Michelle. Suddenly I was sorry, I can't hear you. Now I can hear you right.
Can you hear now?
No, okay.
So let's move on to the next question. So next question is actually our patient from Brunei. The question goes like this. So Dr. Chong, how are you? So I did IVF last time, and if we are planning to do transfer this December, because we do have one frozen embryo left in your clinic, is that possible?
Sorry, I still can't hear you well. But I have the questions in front of me. Is it the patient from Brunei?
Yes, yes.
Okay. All right. So I have the question here. All right. So yes, we do have patients coming from overseas. So yes, it is possible to arrange a visit here. So I just share with you one recent example. So our couple, the wife is in Sabah, but the husband is still working in Europe, and because of the movement control order, he can't enter Malaysia. So it's quite easy. So our center issued a letter to the immigration, and the husband was granted visa to enter. The only thing is before entering the country or on arrival at the airport, they need to do the COVID-19 testing. And after that, needs to be quarantined for 2 weeks. So only after that, they will be allowed to visit us at the clinic. So if this is okay for you, for your traveling schedule, so you can get in touch with us and we can get the letter ready for you and you can fly in. But the only problem is the quarantine for 2 weeks. And after that, of course, you can carry on with the treatment.
Thank you, Dr. Chong. So that is a good news for all our patients outside of KK. So let's move on to our next question here. Apakah faktor utama kriteria sperma lelaki untuk IVF berjaya? Yes, Dr. Hatta, can you hear me?
Yeah, yes, I can. So the question is, apakah faktor utama kriteria sperma lelaki untuk IVF berjaya? I'll answer that in Malay. Sebenarnya untuk memastikan bahawa IVF itu berjaya, faktor-faktor yang patut ada dalam sperma ialah kalau boleh sperma itu kena ada sperma yang normal. Bila saya katakan normal, bermakna dia punya bilangan atau count dia lebih daripada 15 juta setiap mililiter air mani. Pergerakan dia lebih daripada 40% bergerak ke hadapan dan juga morfologi atau rupa bentuk dia adalah lebih daripada 4% normal. Tapi kalau kita ada katakan bilangan kita kurang daripada 15 juta, 10 juta, 5 juta, 1 juta contohnya, ada kaedah yang dipanggil ICSI yang kami buat, iaitu kita memasukkan sperma itu terus ke dalam telur isteri. So walaupun mempunyai kriteria yang rendah dari segi pergerakan dan segi bilangan, ada masih lagi kaedah yang kita gunakan untuk memastikan ada persenyawaan berlaku. Tetapi yang paling penting sebenarnya ialah kesihatan sperma itu. Dan kesihatan sperma itu dari segi bukan saja rupa bentuk, pergerakan dan bilangan, tetapi dari segi DNA composition dia di kepala sperma itu. Dan kita tahu bahawa komposisi DNA ini tidak boleh diubah dan dia tetap, tapi dia boleh menjadi lagi teruk kalau kita mengamalkan beberapa amalan-amalan yang tidak sihat. Contohnya yang satu saya selalu katakan ialah merokok. Merokok ini ada banyak toksin dalam asap merokok itu dan ini akan menyebabkan sperma kita, DNA di dalam sperma kita akan mengalami masalah dan juga kerosakan. Dan apa yang berlaku ialah walaupun nampak dia bilangan dia okey, walaupun nampak rupa bentuk normal, tapi dia tidak boleh menyenyawakan telur isteri. Ya. Jadi sebab itulah saya selalu sarankan bagi mereka yang merokok, bagi mereka yang nak mendapatkan zuriat, kalau merokok berhentilah merokok. Yang terbaik kalau mengikut kaedah ialah 6 bulan sebelum buat IVF tu berhenti merokok dulu. Ini juga termasuk vape termasuk vape. Lepas tu ada amalan-amalan yang lain, contohnya seperti tidak makan makanan yang sihat, exercise, ya, bersenam, kurangkan berat badan, kurangkan makanan yang berproses, kurangkan makanan yang berlemak dan terlalu manis. Banyak makanan yang saya katakan dulu dalam video saya sebelum ni, Mediterranean diet, contohnya macam olive, macam banyakkan sayur-sayuran dan sebagainya. Dan sekarang ini boleh membantu untuk kesihatan sperma kita. Tapi ya, kalau nak ceritakan apa yang faktor-faktor yang boleh meningkatkan lagi sperma kita memang panjang. Saya ada buat siri video man to man yang kita boleh rujuk balik. Bila rasa boleh rujuk balik dalam YouTube channel kita di Sabake untuk apakah kriteria atau apakah faktor-faktor yang boleh membantu sperma saya untuk menjadi lebih baik. So, saya sarankan cuba tengok video-video itu, dan kalau ada apa-apa masalah atau persoalan, anytime boleh datang jumpa kami dan kami boleh beri penerangan yang lebih lanjut.
Thank you, Dr. Hatta. So yes, please feel free to drop by our YouTube channel, Sabake Fertility Center. We do have a lot of very good videos there and a few more series of video in there too. So let's move on to our next question here. Bilakah boleh datang untuk rawatan IUI? Dr. Chong, can you hear me? Dr. Chong?
Still can't hear you well, Michelle.
Yeah.
Okay, on and off. Please repeat again.
Dr. Chong, bilakah boleh datang untuk rawatan IUI?
Oh, bila. Okay, pertama sekali kita mesti buat pemeriksaan dulu untuk pastikan pesakit itu sesuai untuk buat rawatan IUI. Contoh, siapa yang sesuai? Pertama, itu fallopian tube mesti sehat, jangan sumbat. Kalau tube sebelah sumbat tapi sebelah masih okey, sehat, itu masih sesuai untuk buat IUI. Tapi untuk sesiapa kalau dua-dua tube pun sumbat, memang tidak sesuai. Kedua, husband punya sperma mesti sehat juga. Ataupun kalau ada masalah pun tak boleh teruk sangat dari segi bilangan ke, aktif ke. Kalau sperm okey, tube okey, memang sesuai untuk buat IUI. Biasa kita buat IUI, kita akan guna bantuan ubat subur juga. Dan ubat subur boleh yang jenis yang makan, tablet ataupun suntikan. Kalau kita banding dua cara ini, suntikan punya peratusan berjaya adalah lebih tinggi. Dan biasa kita mulakan rawatan pada haid hari kedua ke ketiga. Maksud peringkat awal haid. Lepas kita start rawat ubat subur, kita akan bagi appointment untuk buat scan, transvaginal ultrasound scan atau TVS untuk tengok perkembangan telur. Kadang-kadang mungkin dia ambil masa 14 hari, 16 hari. Bila scan dah menunjukkan telur dah ready, saiz dia dah cukup besar, cukup matang, kita akan buat IUI 2 hari lepas. And macam Dr. Hatta explain tadi, IUI adalah sangat simple. Macam buat pap smear saja. Biasa kita menjalankan prosedur IUI di klinik sahaja. Dan lepas buat, kita akan bagi ubat kuat rahim untuk 2 minggu. So itulah rawatan IUI.
Thank you, Dr. Chong. So I think Dr. Chong actually answered half of the next question as well. So our next question is, what is the process before IUI? So apart from whatever Dr. Chong has explained just now, is there any other thing you would like to add on for this question? Doctor, can you hear me?
I realize when two of us, I can hear you. But when Dr. Hatta is in, I can't hear you.
Okay. Anything
Now he
to
can't
add
hear
on?
us, is it?
Can you hear me?
Yes, I can.
Yeah. Okay.
I said I'll repeat what I just said. So Dr. Chong actually answer half of the next question. So our next question is, what is the process before IUI? So apart from your explanation just now, is there any other thing you would like to add on for this question? What is the process before IUI? Sorry, I can't hear you, Dr.
Sorry, what is the process before IUI? That's the question, Dr. Chong. What is the process before IUI?
Yes.
Dr. Chong. Okay, let me explain. What is the process
Dr.
before
Hattai,
IUI?
can you explain?
Okay, process before IUI is that's like I mentioned, like Dr. Chong mentioned also before, certain criteria that you need to meet before you embark in IUI. Number one, of course, you have to come and see the doctor, because we have to see whether you are suitable for IUI or not. As mentioned before, you have to see your sperm results, whether it is normal or not. As I mentioned before, IUI, it's better to have a normal sperm count, morphology, and motility. Number two, we have to ensure that the tubes are not blocked. So in IUI, you must have patent tubes. Tubes are not blocked, either one or both tubes, both tubes. And number three, we have to see whether you are ovulating or not. And number four, you have to come in for a scan. So we can rule out any other conditions that you may have, like ovarian cysts, endometriosis, and things like that. So these are the criteria that you must have before you go for IUI. And then also here in our center, we also take blood to look at the hormones in your body, especially for the wife. And also we take blood for both husband and wife to screen them for infective disease like HIV, hepatitis B, hepatitis C. So these are the things that you need to prepare first before you go for IUI. So my advice is come and see us, and we will discuss to see whether you are suitable or not for IUI. All right?
Thank you, Dr. Hatta. I think Dr. Chong is having some connection problem. We'll let her rest for a while. Yes, we have Dr. Chong back now. So, hi, Dr. Chong, can you hear me better now? Hi, Dr. Chong, can you hear me better now?
Sorry, I still can't hear you. Try again.
Can you hear me better now?
Yes.
Yes? Yes?
Yes.
Okay.
Yes.
We'll move on to the next question then. For IVF, until what age for a higher chance of getting pregnant?
Okay, this is a very good question, and this is also something we always want to explain to our patients before we start IVF treatment. And as I say just now, IVF has the highest success rate among all fertility treatments, average around 30 to 40%. But the younger the lady, the higher the success rate. So for ladies 35 years old and younger, we are expecting an average success rate of even up to 50%. But from the age of 35, it starts to drop. At the age of 40, it drops to almost 20% and drops even more rapidly. And at the age of 45, it is almost 0%. So that's why we always advise our patients not to delay their treatment. So some of you may ask, I'm already 46 years old, and you say at 45, the chances is also already very low. So what can I do? We do offer IVF with egg donation for those who are 45 and above, but these are only allowed for non-Muslims. So the take-home message is, don't delay treatment. Do it when you are young.
So main important message, do not delay treatment. So let's move on to our next question is, untuk tube tersumbat, adakah cara lain untuk clear tubes? And adakah boleh teruskan IVF tanpa perlu buang tube fallopian?
So ada two questions, ada dua soalan tu. Satu ialah kalau tube tersumbat, bolehkah ada cara untuk memecahkan atau unblockkan tube itu? Jawapan dia sebenarnya tidak ada cara yang tuntas atau cara yang kukuh untuk kata unblockkan balik tube yang tersumbat. Kalau tube tu tersumbat di dalam tube, selalunya disebabkan oleh parut. Jangkitan kuman sebelum tu menyebabkan parut tu menyebabkan blok tube, seluruh tube di dalamnya. Selalunya tube tu akan rosak. Jadi tube akan rosak, sebenarnya tidak dapat ada cara baik operation atau makan ubat yang boleh unblockkan tube yang sudah block. Adapun kalau tube tu dia block di hujung, di hujung, katakan ini pangkal, di hujung tube. Kadang-kadang ada operation yang kita boleh buat untuk memecahkan jaringan-jaringan parut itu. Dan kadang-kadang itu boleh membuat tube tu tidak block balik, ya. Tidak tersumbat balik. Tetapi selalunya tube itu sendiri sudah mengalami masalah kerosakan, ya. Jadi tube ni, apa penting tube ni? Tube ni sebenarnya tempat di mana pertemuan di antara sperma dengan benih. Ataupun telur ovary, telur wanita. Jadi kalau dia tersumbat, tidak ada pertemuan di situ. Tapi secara kasarnya, tidak ada operation ataupun ubat yang boleh melepaskan blok yang tube yang sudah tersumbat. Jadi itu bawa ke soalan yang kedua. Kalau dalam IVF, perlukah tube? Dalam IVF sebenarnya kita tidak perlu tube. Pasal dalam IVF, kita sudah senyawakan telur isteri dengan suami punya air mani itu di luar makmal. Dan terjadinya embrio, bila terjadinya embrio, kita masuk balik ke dalam rahim. So, kita tidak perlu tube. Tube boleh rosak dalam IVF, tak penting. Ya? Tube tidak penting. Akan tetapi, soalan yang kedua tadi itu, perlukah saya buang tube saya sebelum saya buat IVF? Perlu jikalau, ya, anda perlu buang tube anda kalau anda buat IVF jikalau tube itu mengalami bengkakan. Disebabkan oleh rosak tube tadi, disebabkan oleh tersumbat tube tu, dia rosak, dan rosak tu kadang-kadang boleh menyebabkan tube tu bengkak, yang kita panggil hydrosalpinx. Jadi kalau hydrosalpinx, apa yang berlaku ialah dalam tube tu ada air. Air ni agak toksik kepada embrio. Jadi kalau kita buat IVF, kalau kita pindahkan, bila masa kita pindahkan ovary itu, pindahkan embrio itu balik ke dalam rahim, kalau kita ada tube yang bengkak, hydrosalpinx ni, toksin dalam tube yang bengkak itu boleh tolak balik embrio itu ataupun boleh membunuh embrio yang kita simpan balik semasa IVF. Jadi kalau kita ada hydrosalpinx, bengkak tube, lebih baik kita buang tube itu sebelum kita lakukan IVF atau sebelum kita letak balik embrio tu balik ke dalam rahim. Yeah. So itu satu kaedah, satu masa di mana satu keadaan di mana kita terpaksa buang tube. Tak perlu, sebenarnya tak perlu nak buang seluruh tube. Kita boleh buat operation di mana kita boleh clip tube tu, supaya yang penting ya kita jangan ada connection ataupun hubungan di antara tube dengan rahim. Pasal macam saya katakan tadi, kita tak nak mau air dalam tube hydrosalpinx tu membunuh embrio yang telah kita simpan balik dalam rahim. So pada masa itulah kita, sebelum kita buat IVF tu, pada masa itu kita kena buang tube pada masa itu. Kalau tidak ada hydrosalpinx, walaupun tube tersumbat, sebenarnya tak perlu untuk kita buang tube. Ya. Okay.
Thank you, Dr. Hatta. So let's move on to our next question is it useful to monitor follicle development if we are trying to conceive? And which day of the cycle? Dr. Chong, can you hear my question? Dr. Chong, can you hear my question?
Okay, please repeat. Now I can hear you. Just now I couldn't hear you.
Okay, the question is it useful to monitor follicle development if we are trying to conceive? And which day of the cycle?
All right. So follicle tracking usually means we'll do a transvaginal scan to look at the growth of your follicles. Yes, TVS, transvaginal scan, when we look at the follicle directly, has to be the most accurate way of knowing your follicular growth. It is very useful. For somebody with regular cycles, usually we can start scanning them from day 10 of their period, because that is when the follicles is about to get mature. And mature means the follicle size is around 70 millimeters. And depending on the size, we will get the patient to come back either after 2 days or 3 days or 4 days, depending on the size. So I would say the advantage of doing this tracking is we can see it directly, and we can know the timing of ovulation very accurately. And I can say that for somebody with irregular period, this is particularly important, because for somebody who has irregular period, it is very difficult to estimate your time of ovulation. So we definitely will advise follicle tracking for us to monitor the growth and the timing of ovulation. And for somebody who has regular 28-day cycle, if they can't come for the scan, they can still do their self-urine ovulation test to determine. For somebody with a regular cycle, it is easier to do the self-monitoring, but not for those with irregular period. So for those with irregular period, definitely the follicle tracking with the use of transvaginal scan helps a lot.
Thank you, Dr. Chong, for your clear explanation. So let's move on to our next question is, should embryos be genetically tested?
Should embryos be genetically tested? You want to take that, Dr. Chong? Dr. Chong, can you hear me? Hi, Dr. Chong. Okay.
Yes.
The question is, should embryos be genetically tested?
All right. This is what, when we are talking about additional procedure on top of the standard IVF, which is PGT or pre-implantation genetic testing. So the standard IVF without this PGT is when we obtain the embryo. We haven't tested the DNA contents, but we will transfer it back to the woman's uterus. PGT is a technology where before implant, that's why it's called pre-implantation, we would test the genetic material of these embryos to see which one is normal, for us to select the normal embryo to transfer back to the woman's uterus. If you ask me who needs PGT, maybe not everybody, because PGT will add on additional costs to the IVF. Maybe a few examples that I can share, which this group of ladies will benefit from PGT. For example, older ladies, because we know that the older the female, the higher the risk of having abnormal baby, for example, Down syndrome. So by doing a PGT, meaning we test the embryo first, then we can select those embryo which is normal to transfer, then we can avoid having a chromosomally abnormal embryo. So that's the first example. And second example is sometimes we do it for patients with repeated IVF failures. Every time when we put in the embryo, even though the embryo looks good, but they just don't want to implant, because we know that abnormal embryos also don't implant easily or don't implant successfully. So by doing PGT, it will help us to select the normal embryo, and hopefully by going straight to transfer the normal embryo, it will help in the implantation and therefore the success, to increase the success rate of the IVF. And a third example is something which we see quite often, especially in Southeast Asia, which is those who which those couple with inherited disease, the commonest example here is thalassemia. So for example, if husband and wife, both of them are thalassemia carriers, there is a 1 in 4 chance of them getting a thalassemia major baby. So by doing PGT, we can select those embryo which is normal and doesn't carry the thalassemic genes for us to transfer. In that way, we can help the couple to avoid the risk of having a thalassemia major baby. So those are the indications for doing this PGT, which is a pre-implantation genetic testing for the embryos before we do the embryo transfer.
Thank you, Dr. Chong. So our next question here is directed to Dr. Hatta. So after successful IVF last year with Dr. Hatta, my baby is now 8 months old. So when is the best time to do our second transfer of blastocyst?
Okay, my baby is now the first child is 8 months old. Alhamdulillah, it's quite big already. So when's the best time for you to do the second transfer? Actually, to be honest, anytime. Anytime that you feel that you want to have a baby, you can come back and do the transfer of the remaining embryos that you have. So, but I would advise you to sort out the things like who's gonna, if you do get pregnant again, or who's gonna take care of the first child and all that. So the embryos frozen in our tank are safe, and usually they can be kept there, and usually we keep it for 5 years. So anytime that you wish that you want to have another child, you can always come back and we plan your frozen embryo transfer program so that you can transfer your embryos anytime, right? And I think this first child, if it's breastfeeding, is actually best time after 6 months of exclusive breastfeeding. Now is the time where you wean off or you give a supplementary food to the child. Then also the best time you can do your transfer, especially when you get your periods back. So once you get your periods back again, do give us a call and we can sort out the program for your frozen embryo to be transferred back into your uterus. Okay.
Thank you, Dr. Hatta, and congratulations again to this successful patient. So let's move on to our next question is, adakah pengambilan suplemen membantu dalam kejayaan IUI atau IVF?
Adakah pengambilan suplemen membantu? Ada setengah suplemen boleh membantu untuk meningkatkan kebarangkalian untuk kita punya IVF dan IUI. Contohnya, dia ada lelaki dan perempuan. Setengah suplemen untuk lelaki boleh membantu. Kalau kita tengok balik video-video saya yang saya ada kita buat di YouTube channel Sabakare, saya sudah explain untuk bahagian lelaki apakah suplemen dan diet yang penting untuk meningkatkan kebarangkalian untuk membantu. Banyak cerita jajah besar. Dia banyaklah, contohnya macam selenium, zinc, omega 6 dan sebagainya. Ini semua boleh membantu. Untuk wanita pula, suplemen yang penting ialah antaranya folic acid, contohnya kalau mereka yang punya vitamin D yang kurang, boleh ambil vitamin D, ya. Kita boleh check kalau vitamin D kita kurang dalam badan, kita ambil darah dan kita hantar ke makmal. Kalau vitamin D kita kurang, kita boleh tambah dengan makan suplemen vitamin D. Setengah vitamin penting juga macam vitamin C dan vitamin E yang mempunyai antioksidan. So ada beberapa suplemen yang boleh membantu. Dia bukan meningkatkan kebarangkalian untuk IVF tu more successful, tapi dia boleh membantu untuk mendapat badan kita menjadi lebih sihat dan juga boleh menerima IVF tu sendiri dan increase your chance of pregnancy. So kalau ada masa, pergi balik ke video yang kita pernah buat sebelum ni dan boleh dapat lebih banyak information daripada situ.
Thank you, Dr. Hatta. So we'll move on to our last question of the day. Our last question of the day is, Bolehkah IVF treatment dibuat dalam masa 1 bulan? Sebab saya bekerja overseas and I need to plan my leave and quarantine for both countries. So, possible to do IVF treatment, everything all in 1 month? Hi, Dr. Chong, can you hear me?
I can hear the last part. Please repeat the whole thing. Sorry.
Bolehkah IVF treatment dibuat dalam tempoh 1 bulan? Because I work overseas and I need to plan my leave plus the quarantine for both countries. So is it possible for me to complete the whole IVF treatment in 1 month time?
I think it's only 1 month. Probably it is a bit difficult because usually the moment you see us, even when we are ready to start, the stimulation may take up to 10 to 12 days. And by the time we do the egg collection, it will be slightly more than 2 weeks. And normally, few days later, then only we will proceed with the embryo transfer. So the suggestion I have, probably it will be split into 2 steps, meaning the initial trip will be for us to stimulate and do the egg collection. And the second trip will be mainly for embryo transfer. And the other suggestion I have is if we can arrange this before your trip. For example, if you can manage to get the medication and we can arrange for doctor at your area to help doing the scans. So maybe we can start part of the treatment beforehand. So I think it's still possible, but the best way is to get in touch with us, then we will know exactly your period timing. And if we can't get the whole process done during the first trip, the other option will be what I mentioned just now. So the egg collection and the embryo transfer will be split into 2 separate trips.
Thank you, Dr. Chong, for the clear explanation. So this concludes our Q&A session. So now we'll proceed to our favorite session of the day, where people will win a prize worth 260 for a screening package for both husband and wife. So Dr. Hatta, would you like to pick a winner of the day?
You have to say hi, isn't it?
Yes. So everyone, if you are still here, following until the end of the session, please say hi so we know that you are here. And please respond to us so we know that you are still here and you get a chance to win this screening package.
I can't see it. Okay, I think I can see the hi. There are a lot of hi. I think I say Chung Kit Yin. Chung Kit Yin?
Yes. Congratulations, Kit Yin Chung. Congratulations, you are the winner of the day. We will PM you later for more details, and you'll be receiving this fertility screening package for both husband and wife. So congratulations once again, and thank you, Dr. Hatta and Dr. Chong, for all your time today.
Thank
and
you,
I hope that answered a lot of questions today.
Yes.
So please, everyone, please feel free to visit our YouTube channel, Sabah Care Fertility Center, for more information and background knowledge on IVF and a few more series like man-to-man, IVF, and IUI. So thank you, everyone.
Thank you. Bye, everyone.
Bye, everyone.
Bye.